Inhalational agents of general anesthesia. So classification, current use and obsolete. So in the current practices we have these gaseous and volatile agents. Gaseous agents we have nitrous oxide, xenon, and volatile agents we have halothane, sevoflurane, isoflurane and desflurane, and the obsolete agents are the enflurane, ether, methoxyflurane, trilene and chloroform. So mechanism of action is site in the CNS, it causes amnesia. In spinal cord, causes mobility. Receptors are it acts by the GABA or the glycine receptors, whereas the gaseous agents like nitrous oxide and xenon will uses the NMDA receptors. These will get directly binding to the cellular proteins. So potency of the inhalational agents. So potency is directly proportional to the lipid solubility according to the Mayer-Overton rule. We have minimum alveolar concentration, which is an indicator of the potency. So minimum concentration which is required to produce as the immobility in 50% of the subjects, giving the painful stimulus like skin incision. So most potent overall it is in the current use it is halothane, and least potent overall it is the nitrous oxide, whereas the volatile agent it is a desflurane. Second, it is a blood gas partition coefficient, which is also known as blood gas solubility. It is an indicator for the induction and recovery. So fastest induction and recovery seen with the overall it is with the xenon, and current use it is a desflurane, and so slowest induction and recovery overall it is a methoxyflurane, and the current use it is a halothane. Other effects like concentration effect, augmented inflow effect, second gas effect and diffusion hypoxia, which is nothing but the Fink effect is seen with the nitrous oxide. For example, if high concentration of the nitrous oxide is present in the lungs, so the next step it is uptake of the nitrous oxide in the blood, and leads to decrease of the concentration of nitrous oxide in the lung. There is a widened gradient between the anesthesia machine and also the lung, therefore increased inflow of the nitrous oxide from the machine. This is known as augmented effect. So increased inflow leads to high concentration, so leading to concentration effect. So it will also increases the concentration of the inhalational agent along with the nitrous oxide. This is known as second gas effect. When we do the recovery, that is stop the anesthesia machine, there will be decrease in the concentration in the lungs and increase the flow from the blood to lungs, replacing the oxygen. This is known as diffusion hypoxia, which is nothing but Fink effect. Treatment for this is give 100% of the oxygen for 10 minutes at least after discontinuing the nitrous oxide. So systemic effect are the first, it is the respiratory system. All inhalational agent will inhibit the respiration, therefore increases the work of breathing. Minimal increase seen with the sevoflurane, and ciliary function all will inhibit the ciliary activity. So maximum with halothane and minimum with sevoflurane. And bronchial muscles, it causes bronchial dilatation in the normal persons. Maximum with sevoflurane followed by the halothane followed by isoflurane, and desflurane will increases the airway resistance. So as the sevoflurane will causes the bronchodilation, therefore inhalational agent of choice in the asthma. And next system it is cardiovascular system. So all inhalational agent will decreases the cardiac output. Minimal decrease is seen with the isoflurane. So it is inhalational agent of the choice in the cardiac patient, including the MI. And CNS all will decrease as the cerebral metabolic rate and increases the intracranial tension, increases the cerebral blood flow. So minimum increase in ICT is seen with the sevoflurane, therefore it is an inhalational agent of choice for the neurosurgery. In the hepatotoxic is the halothane only. And next all the inhalational agent will decreases this hepatic blood flow. So maximum decrease in with the halothane and a minimal decrease with sevoflurane. So it is used as an inhalational agent of choice for the hepatic patients. And renal, it is a nephrotoxicity. So because of the fluoride ion on the metabolism, so overall maximum fluorides are released by the methoxyflurane. but in current practice it is a sevoflurane. So no fluoride are seen with the desflurane. Therefore desflurane is inhalational agent of choice for the renal patient. On uterus, all are equally effective uterine relaxant, and muscle relaxant. Maximum muscle relaxation is seen with the desflurane. Analgesia, current use volatile agent cause almost no analgesia. Amnesia, very good except the nitrous oxide, which is a poorly amnestic, and metabolism. So nitrous oxide no metabolism, and desflurane shows minimal metabolism, and halothane will get metabolized by the oxidation, whereas all over is metabolized by the oxidation. So gaseous agents, firstly it is a nitrous oxide, which is also known as laughing gas, and it is not metabolized, and properties are it is 30 to 35 times more soluble than the nitrogen, and it supports the fire. And anesthesia property, it is of least potent and not a complete anesthesia, but good analgesic property is present. Side effect, it increases expansion of the air spaces. So absolute contraindications are the pneumothorax, pericardium, pneumomediastinum, and avoided for the tympanoplasties, air embolism, intestinal obstruction, diaphragmatic hernia, and also the microlaryngeal surgery, because it will aggravate the post-surgical edema by causing the expansion of the endotracheal tube, and chronic exposure may causes the bone marrow dysplasia and subacute degeneration of the spinal cord, and megaloblastic anemia, more than 12 hours of use, and destructive to ozone. Next, xenon. Xenon, it is of more potent, and it is ideal in inhalational agent, and it have good analgesic property and good anesthetic property. There is no side effects like nitrous oxide, and it shows faster induction and recovery, no second gas effect, no diffusion hypoxia, and it is an inert gas, therefore no systemic side effects, and it doesn't support fire. Disadvantage is it's very expensive, and it can causes the airway resistance, so it is not used in the asthma. Entonox, which is 50% of the nitrous oxide and 50% oxygen, it is used for the labor analgesia and also the dental analgesia. Heliox, 21% of the oxygen and 79% of the helium, and it is more common used combination, and second combination it is 70% helium and 30% of the oxygen, and it is low density, and uses is used in the upper airway obstruction like tracheal or bronchial stenosis. As it having the low density, it can easily pass through. Halothane, anesthetic properties, it is the most potent, and slow induction and recovery, and metabolism. A major metabolite is trifluoroacetic acid, and systemic side effects are CVS. It sensitizes the heart to the adrenaline, therefore contraindicated in the pheochromocytoma. In the liver, it causes the halothane hepatitis, which is immunogenic due to its metabolite, that is trifluoroacetic acid. It is a antigenic. Isoflurane, it causes the irritating induction. It causes minimum decrease of the minimal decreases the cardiac output. So it is agent of choice in the cardiac patients, including the MI. There is no coronary steal. And desflurane. Desflurane is an isomer of the isoflurane. It is of least potent and fast induction and recovery, and there is no fluoride, therefore it is used in the renal failure also, and it reacts with the desiccated soda lime to produce the carbon monoxide. So anesthetic property, and it is an agent of choice for the daycare surgery. More than 6% of desflurane will stimulate the sympathetic system, so it will causes the tachycardia and hypertension, therefore avoided in the MI patient, and it is used inhalational agent of choice in the shock. So IV agent, it is the ketamine. Sevoflurane, it is for pediatric induction, as it has a smooth induction. So first we use as the propofol, and first inhalational agent, it is the sevoflurane. Second choice we use the halothane. We should not use as the iso and desflurane. We can't be used for the induction in the pediatric patient as they are irritant, and hepatic patients it causes minimal decrease in the hepatic blood flow, and it is used in the neurosurgery because of minimal increase in ICT, and also asthmatic maximum bronchodilation, and also used as in daycare surgery. Disadvantage, it produces the compound DA, burns the respiratory tract, and high fluorides, therefore avoided in the renal patient, and conversions are very rare, which can be seen only in the children. Enflurane, it is highly epileptogenic. Trilene, it is contraindicated in the closed circuit because it with soda lime will causes the neurotoxicity and also the ARDS. Next, methoxyflurane, it is a maximum nephrotoxic because of maximum fluoride ions. Next, chloroform will causes the ventricular fibrillation and cardiac arrest. And ether advantage, it is cheap and it is a complete and safest. Disadvantage is it is inflammable and explosive, and induction and recovery are horrible, unpleasant, and nausea and vomiting.